Hello, I am Melva Tasca Kane Henderson, President of Chi Tau Omega chapter of Alpha Kappa Alpha Sorority Incorporated. Today we would like to welcome you to our Worship in Pink celebration. As a breast cancer survivor, I know all too well about this journey. But today we would like to take an opportunity to celebrate our survivors, as well as to recognize and remember those who fought a good fight but lost the battle. Chi Tau Omega chapter has been hosting Worship in Pink for several years now. We are always excited about connecting with our community partners. Today, again, we celebrate our survivors during our Worship in Pink celebration. Thank you so much for joining us and welcome.
Let us look to the God who brings comfort, hope, healing, and grace. Father God, we humbly pray for all those who are fighting breast cancer. Give them the hope and the courage that they need each and every day. Comfort them in their pain and bless them with healing. Strengthen their family, their friends, and caregivers. God of healing, mercy, and grace, it is in the name of your dear Son that we come to you today. We ask you to stretch out your hand in compassion, in restoration, in healing, and lifting up those who are bowed down and burdened with breast cancer. Embrace us now in your loving care, particularly those who are afflicted with breast cancer. We come to you standing in the gap, asking, Son of Man, will you rise today with healing in your wings? May the Spirit of Christ bring to us all health and healing in our minds, in our soul, and in our bodies. We thank you that by your stripes we are healed on today. And we thank you for the testimonies of survival, for those who have already overcome this dreadful disease. We thank you today on their behalf. We ask that you will continue to give strength, continue to give hope, continue to give joy. And it is with thanksgiving that we praise you for what you have already done, and we look forward to more testimonies of your goodness, your mercy, and your grace. It is through the name of Jesus Christ we pray and we believe. Amen, amen, and amen.
Hello, I'm Cheryl Vicks Crawford. I'm the program chair for Chi Tau Omega chapter of Alpha Kappa Alpha Sorority Incorporated. On behalf of the 290 plus members of Chi Tau Omega chapter of Alpha Kappa Alpha Sorority Incorporated, we thank you for joining us for our Breast Cancer Awareness Moment during the month of October, which is celebrated as Breast Cancer Awareness Month in the United States. Thank you, Target 2 Women's Health and Wellness Committee, led by Reverend Darlene Smith and Mrs. Sharon Goodwin Griffin. Thank you, Dr. Phillips, our guest breast cancer specialist, for sharing your passion and knowledge and your commitment to our community of service. To Pastor Young, Pastor Stegall, and Pastor Thomas, thank you for being our community partners to get the word out that early detection does make a difference. Tell your sisters, tell your daughters, tell your friends. Get your breast exams, get your mammograms, see your doctor. Let us hear the latest updates regarding breast cancer from our guest speaker, Dr. Roxburgh Phillips. Again, thank you for joining us.
On behalf of Sisters by Choice, I'd like to thank Chi Tau Omega and their president, Reverend Henderson, and vice president and a dear friend, Reverend Vicks, Cheryl Vicks, for their support of Sisters by Choice. I'd like to say a special thank you to Dorothy Moore. She is also a patient of mine who for many years has led her sorority, Chi Tau Omega, to help raise funds for Sisters by Choice and has raised over $25,000. Thank you.
There have been a lot of questions that I asked members of the Alpha Kappa Alpha sorority to send in. And one of the biggest ones was the number one question is, what is breast cancer?
Breast cancer is no different than any cancer that we see. Cancer is where your normal cells mutate. Mutate means changes, and they grow. They outgrow your normal cells. Cancer cells invades your normal cell. Instead of pushing it away, it kind of invades and take over. And also it can spread from one part of the body, meaning the breast. It can spread from your breast to your lymph nodes. It can spread to other parts of the body, whereas a benign tumor simply just kind of grows and grows, and it takes up space, but it doesn't spread from one site to another.
Then how does it kill you?
It kills you by spreading to different organs and really taking over your body. When we talk about early breast cancer, we're talking about stage 0, stage 1 and 2. Usually those cancers are limited to the breast, and they're easier to take care of, treat. They respond better to the treatment that we utilize. When you have stage 3 and stage 4, and stage 4 is when the tumor has spread outside of the breast and the lymph nodes to other parts of the body, that's what causes it's really difficult for it to treat.
How is it detected? I mean, you talk about mammograms, but specifically, how do you see it in a mammogram?
The most important thing in doing a mammogram is that it's not just a mammogram once in your lifetime. You know, it's really and truly annual mammograms, because each year you do a mammogram, we can compare the changes from one year to the next, and that's the most important thing. We look for calcifications, and as said, we look for abnormal density. We compare your right breast to your left breast. We're basically symmetrical, and your right breast should look like your left breast.
So there are all types of breast cancer then, I would assume.
Over years of increasing, our knowledge and learning about, breast cancer, how it grows, learning the biology of breast tissue, we realize that there are many, many different types of breast cancer, and some are favorable and some, unfortunately, are very, very aggressive.
And the most aggressive, I understand, hits African American women?
One of the aggressive types, triple-negative breast cancer, is seen more in African American women, or is seen in a higher percentage of black women who get breast cancer. A higher percentage of them will have triple-negative breast cancer as opposed to white women. They have a lower percentage of triple-negative breast cancer.
There's a lot of controversy as to when you should begin screening, when you should get mammograms. The
average woman should get mammograms starting at age 40, and they should continue that mammograms annually, this is what I always tell them, until they have one foot in the grave. I mean, because the older you get, the more your risk is getting breast cancer. The number one risk factor of breast cancer is being a woman, your gender, followed by increasing age, followed by your personal history, meaning that if you have a breast cancer in one breast, your risk for getting breast cancer in the opposite breast is increased. And fourthly, the having a family history.
If you have a history of breast cancer, or breast cancer runs in your family, then at what age do you start?
I start 10 years earlier with a cutoff of age 25. When you're young, the reason we don't do mammograms is because you have dense breast tissue, meaning that it's very difficult for the x-rays to penetrate and give you any significant information about what's going on in your breast. But if you have a family history of breast cancer, yes, you need to consider doing mammograms, as I said, 10 years earlier.
What about self-screening or trying to figure out whether you can examine yourself?
One of the things that every woman should be doing is examining their breasts. Sometimes, it will, take many, many months before you really feel comfortable examining your breast. But I think one of the tools that I try and teach my patients is do what we call breast mapping, where you Start examining your breast, and you map out what you feel. No medical terms, in your own words, what are you feeling in your breast? Next month, you do the same thing, and you look at what you jotted down the previous month. And if you do that continually, because your breast will not change, from one month to the next. If you do that, you will find out what your breast tissue feels on and feel comfortable examining your breast. And so if you examine your breast and something has changed, you'll be the first person to pick it up.
If you're diagnosed with breast cancer, should you get a second opinion? Should you look at genetic testing? I mean, what do you do?
The most important thing is that you need to have trust in your physician and feel that they're going to give you the best of care. Second opinions are important. And you as a patient, and regardless of any field of medicine that you're dealing with, you have to feel comfortable until you get that comfort zone. Get in that comfort zone. I mean, I tell my patient to do what you need to do in order to move forward.
And I think a lot of patients are afraid to do that because they think the doctor is going to be offended.
Right. They feel that, we're going to get upset with them. No, I think second opinions are always important. And if you feel you need one, by all means, get one.
I know a lot of people are wondering about the various treatments, and it obviously depends on the different stages that people are in.
Most people, it's a rarity that you don't have some form of surgery. Surgery, radiation, chemotherapy, targeted therapy, or immunotherapy. Those are basically the different treatment plans that we use. And each patient, depending on the biology of the cancer, we will recommend different things.
You really have to look at everything.
When we initially approach a patient with breast cancer, our goal is to cure them. So we have so many tools that we can use to make sure that the patient get the best possible care.
When is a biopsy needed?
You look at a mammogram. The mammogram will be given a code. That code is, we call it BI-RAD. It means that and then we put a number on it. So it will go from 0 to 6. So when you have a 4, 5, or 6, those will be definitely recommended to do a biopsy, all right? What else is recommended to do a biopsy? You do a biopsy, if I have a youngster, meaning someone between 25 and 35, all right? And they have a lump in their breast, and I think that it is benign, and I'm going to remove the lump. I don't want surprises when I get to the operating room, so I may do a biopsy.
If the biopsy returns as positive, then what?
My patients, number one, after being diagnosed with breast cancer, you get an MRI, okay? The MRI not only looks at the breast that was biopsied, but it looks at the opposite breast. And so it gives you, make sure that nothing is in the opposite breast that we need to be addressing at that time. So you do your biopsy, you do your MRI. So going forward, additional tests that you get depends on the stage of the cancer. If you have an early cancer, that's all you need at that point. We look at the tumor markers or the biology of your cancer, and today breast cancer is what we call a multidisciplinary approach. You see your oncologist, you see your radiation therapist, and your surgeon. And if you're going to do plastic surgery, you see your plastic surgeon. And everybody, have their input how you should be treated. All right. So that's your team, and they decide on your treatment plan. And once the treatment plan is decided upon, it is, a conference with you to say, this is what we feel is going to give you the best chance for a cure, and ABC, this is what needs to happen. And at that point, we listen to you.
What are the range of side effects that could happen?
Each one of us, we react differently toward medication, and you just have to kind of see. But I think for the most part, if you're going to have chemotherapy, 100% you're going to lose your hair. 100%, 200%, you're going to lose your hair. You have some degree of nausea and vomiting. We give you medicine to kind of, deal with that side effect. the dehydration. You have to make sure you're drinking plenty of liquids. And sometimes people get constipated, sometimes they get, diarrhea. So it really and truly depends on how your system reacts. But it also depends on where your baseline, where you start with this disease. If you are, in general in good health, you do as well as the next person. There's a whole host of different things that we try and supplement our patients with when they're going through chemotherapy. And if you're taking one of the anti-estrogen medicine, if you're going to hit smack dab in postmenopausal symptoms, I try, and one of the things that work for my patients is acupuncture. I encourage acupuncture, and it helps a lot.
You've been diagnosed and you don't have insurance. What are your options?
But once you're diagnosed with breast cancer, you can apply for emergency women's health Medicaid, and they will immediately, you are qualified and take over the expenses. In most hospitals and most physicians, we honor that, and we make sure you're taken care of. With Sisters by Choice, we have kind of set our goals on targeting women who cannot afford mammograms. We're a small organization and we do provide some biopsies, but we really and truly do not have the funding to try treatment. But for, diagnosing, mammograms, annual mammograms, screening, women who are indigent, who do not have insurance, we can provide them with some services.
Is there anything that you think we haven't covered that you want to talk about, or at least give advice to women?
I still see too many African American women who are diagnosed with breast cancer who do not get treated. Remember, when you make that decision not to be treated, you're not making that decision for yourself. You're also making it for your family, because your family are going to be there in the end. They're going to be the one that's got to, take care of you. You got to watch this nasty, ulcerating, cancer that's smelling. They got to take care of you. I mean, you don't want to die that way. You just don't. Untreated breast cancer kills. That's the bottom line.
The women of Alpha Kappa Alpha Sorority Incorporated are committed to increasing voter turnout in this upcoming 2020 election. Our sorority knows that voter mobilization can change the trajectory of this country, and we're dedicated to making sure voters use their power and voice.
Elections have long-term consequences, so Alpha Kappa Alpha's International Connection Committee, the social action arm of the sorority, aims to mobilize all eligible voters through the AKA's L.E.A.D. campaign.
You have several options to vote. Vote early, vote in person at the polls on Election Day, or you can decide to vote by mail.
Make a voting plan today. Studies show that if you plan your voting method in advance, you are more likely to follow through and actually vote.
Increasing voter turnout includes galvanizing the newest and youngest voters, members of Generation Z, which includes me, to vote in this election. We challenge voters between the ages of 18 to 24 to text at least 8 friends to confirm they have a plan to vote.
For millennials who often feel like their vote does not matter, you are quickly becoming the largest generation in the electorate. We are encouraging millennials, like me, to share your vote plans across your social media networks with your friends and followers, and encourage those friends and followers to create their own vote plan.
There will likely be an overwhelming amount of mail-in or absentee ballots, especially amongst voters like me, pre-baby boomers and baby boomers. We want boomers to phone bank, and above all, make sure that if a mail-in or absentee ballot was requested, there is a plan to return it.
Despite what generation you belong to, you can safely vote in person in 41 states across the country. You can do so by voting early in person or on Election Day at the polls. The perks of voting early are avoiding possible crowds and decreasing potential COVID-19 exposure.
9 states do not offer early voting options, and many voters are worried about voting in person on Election Day due to the risk related to the COVID-19 pandemic. But fear of COVID-19 should not keep any voter from casting a ballot on Election Day.
Voters should arrive as early as possible to your polling place. Use COVID-19 precautions by wearing a mask and practicing social distancing. Be prepared to stand in line, and please have all required voter identification and documents.
If you're voting on Election Day and need help getting to the polls, please find local options for rideshare opportunities, whether it be through a community church, a free bus ride, or some other alternative. No one should miss voting because they can't get to the polls. This is the most important election of our lifetime.
Alpha Kappa Alpha is aware that increasing voter turnout is paramount, but voter suppression is a real threat. To that end, we are encouraging citizens to become active participants in the process of becoming a poll watcher.
During this time of great uncertainty, the women of Alpha Kappa Alpha Sorority Incorporated will continue to do our part in ensuring safe and fair elections. And now that you have the tools to create a voting plan and know how to combat voter suppression and safely vote in person, be sure to exercise your right as a citizen and vote.